Legionnaires' disease outbreak in New York City. The recent cluster in Central Harlem, New York City, which commenced in late July and was under active investigation as of early August 2025, provides a pertinent example of this threat. As of August 5, 2025, the New York City Department of Health and Mental Hygiene reported 67 confirmed cases and 3 tragic deaths linked to this outbreak. The outbreak has affected residents and workers across several Central Harlem zip codes. The Department of Health and Mental Hygiene swiftly linked this cluster to environmental exposure from contaminated water systems. Investigations identified 11 cooling towers in the affected area that tested positive for Legionella pneumophila. Following city regulations, remediation procedures for all these contaminated towers have been completed. The NYC Health Department urged individuals in the impacted zip codes who are experiencing flu-like symptoms such as cough, fever, chills, muscle aches, or shortness of breath to seek immediate medical care. This advice is particularly critical for high-risk populations, including adults age 50 and older, current or former smokers, and those with chronic lung disease or weakened immune systems. Legionnaires' disease, a severe form of pneumonia, often lurks unseen within modern water systems. Caused by the Legionella bacterium, this severe lung infection poses a significant public health challenge globally. Reported cases of Legionnaires' disease have been on an upward trend since the early 2000s, with a peak observed in 2018. The bacterium derived its name following a significant outbreak in 1976. During an American Legion convention held in Philadelphia, a mysterious and severe form of pneumonia affected numerous attendees, ultimately leading to the identification of Legionella as the causative agent. This historical event underscored the potential for widespread illness originating from contaminated water systems. Identifying Legionnaire's disease can be challenging because its initial symptoms often mimic those of common respiratory illnesses such as influenza or COVID-19. Without specific awareness and diagnostic testing, such as a urine antigen test or sputum culture, cases may be misdiagnosed or treatment initiation delayed. Legionnaire's disease typically commences with headache, muscle aches, high fever, often reaching 104 degrees Fahrenheit or higher. Within 2 to 3 days, other, more severe symptoms can develop, signaling the progression of the lung infection. Cough, which may be dry or productive, sometimes bringing up mucus or even blood. Shortness of breath, chest pain, gastrointestinal issues such as nausea, vomiting and diarrhea, confusion or other mental changes. Symptoms typically appear 2 to 10 days following exposure, though in some instances they can take up to 2 weeks to manifest. While most healthy individuals exposed to Legionella bacteria do not become ill, certain individuals face a significantly higher risk of developing Legionnaire's disease. These high-risk groups include older adults aged 50 years or older, smokers, current or former smokers, weakened immune systems due to conditions like HIV/AIDS, cancer, or immunosuppressive medications. Understanding how Legionella bacteria spread is fundamental to preventing infection. Most people become infected when they breathe in tiny water droplets or aerosols that contain Legionella bacteria. A crucial point to emphasize is that Legionnaire's disease is not spread from person to person. Legionella bacteria occur naturally in freshwater environments like lakes and streams, but typically in quantities too low to cause disease. However, they can multiply to dangerous levels in human-made water systems. Common sources include cooling towers, hot tubs and whirlpools, shower heads and sink faucets, decorative fountains and water features, large complex plumbing systems. It is important to note that home and car air conditioning units do not use water to cool the air and are therefore not a risk for Legionella growth. If Legionnaire's disease is suspected, prompt diagnosis and treatment are critical for improving outcomes. Most people who contract Legionnaire's disease require care in a hospital, often making a full recovery with prompt treatment. However, the illness can be very serious. The mortality rate for Legionnaire's disease is approximately 1 out of 10 cases in the general community. This rate increases significantly for those who acquire the disease in healthcare facilities, where about 1 out of every 4 patients may die. Legionnaire's disease, while serious, is a preventable illness. The ongoing outbreak in New York City serves as a powerful reminder of the hidden dangers that can exist within engineered water systems. By understanding how Legionella bacteria spread, primarily through aerosolized water from sources such as cooling towers, hot tubs, and plumbing systems, proactive measures can be taken to mitigate the risk. Ultimately, protecting communities from Legionnaires' disease requires a shared commitment, individual awareness combined with systemic water safety practices. Thanks for watching. Please subscribe to the channel Microbe Masters for more insights into the microbial world.